I was drawn to heart failure and heart transplant as sort of a bucket of work. How long has it been? A month?
A month, yeah.
Everything been okay?
Yep.
No chest pain, shortness of breath?
No.
Lightheaded, dizzy?
Mm-mm.
Haven't passed out?
No.
Good. There's so many entry points into heart failure. The two main ones are patients that we see in the ambulatory setting. They've had damage, and they sort of grumble along, and their heart gets progressively weaker and weaker. And so they'll be referred to us in the outpatient setting when their heart function reaches a certain threshold or when they become symptomatic. And then the other path is a patient who has an acute event. His blood pressure went up pretty significantly, and he was on a lot of vasodilator. So I think we just need to have a plan for what's going to happen to his blood pressure when we wake him up. And they'll usually be admitted to hospital, and it'll usually be, we need to do something now because what their heart has been left with is not salvageable. I'm just going to tap into the computer here. Unfortunately, I don't have the results of your echocardiogram as yet. Oftentimes when we want to shed light and we want to advocate for a disease process, the easiest to turn to is the young person who in the prime of their life is afflicted by a disease. And the real face of it is a 70-year-old with chronic disease and multiple chronic diseases. To be honest, it sounds like your transplant's the least of your problems at this point.
No.
What we need to figure out is get a sense of how that valve is working that Dr. Chung put in. We're being challenged to look at older patients, and we're being challenged to say, well, have these artificial constructs and cutoffs that have been put in place still apply as people are healthier and healthier into their age, and as well as our technologies for keeping patients alive post-transplant get more robust.
They want me to come in on Friday instead of waiting till next Wednesday.
So coming in just to make sure that things are going okay.
Yeah.
Yeah. There is a intimacy that you develop with your patients, having known them for a very long period of time. I have patients who I have seen from the age of 18 when they were first diagnosed and now see them getting married and having children. We'll see you on next week, if not before. I have that opportunity to spend time with my patients and get to know them and their families in that way. So that's very meaningful for me and adds purpose to all of the work that I do.